Well, hello all you beautiful people, and welcome to the second installment of Do It Right with Dr. Ansu. That's me. If you watched the intro video, well, thank you and welcome back. If you're new to this channel, my name is Ansu. I am an osteopathic physician practicing family medicine, and my goal with these videos is to share with you how I use my osteopathic as well as medical training in my daily practice as a family practitioner. So today we're starting a 2-series part on carpal tunnel syndrome. But before that, disclaimer alert. So you may be wondering why I started with carpal tunnel. Well, I wanted to start with something that was relevant to today's time. We are in the middle of a pandemic. There's more people working from home, using the computers, texting more, spending more time on electronic devices, even children who are spending about 6 to 7 hours on the computer daily for school. That is a lot of time our hands and our wrists are in a position they're not meant to be, which can cause problems over time. So let me give you an example. Here I've got a nice crisp piece of paper, and I am going to fold it. And you can do that if you want to also, just if you want to follow along. I'm going to fold it again. And we're just going to hold it in this position for just a few seconds, you know. It was a nice and crisp piece of paper, but when you unfold it, just a few seconds of being in a bent position has changed this piece of paper. It is no longer nice and flat. It's no longer crisp. It's got these folds. This is just paper. This is what happens to our human body. We have what we call an anatomic position where we're supposed to stand tall, you know, palms face forward. This is the position that our body should be most comfortable in. But with the various activities that we do, you know, hunched over a computer, texting all the time, doing all these things puts our body in a very different kind of position. Imagine, you know, your anatomic position is this way, but when you are on the computer, your body kind of rolls in, your shoulders hunch in, your hands are bent over. And now imagine, for those of you who are spending 8 hours or more on a computer all day, or those who are texting for a long period of time, your hands are in a very restricted position, you know, and over time this restriction causes changes in the area where the restriction is happening. So the carpal tunnel is made up of bones that are the carpal bones on the base of the wrist, and it has this transverse carpal ligament right above it, as you can see in the picture. Within this space, we've got the median nerve, which innervates our first 4 fingers from our thumb all the way to the middle of our ring finger on the palmar side. We've also got some tendons, which are called the flexor tendons, that help us do this, you know. So as I was talking about earlier, when you're on your phone or on the computer, your flexor tendons are always in a flexed position. They don't get to extend as often. On top of that, with that constant pressure on your wrist, there's a lot of swelling that can happen in that area. A lot of fluid buildup can come in that area, and that can cause a lot of pressure. And that pressure can lead to compression of this area called the carpal tunnel. And when you get compression like that, you start noticing symptoms. So some of the more common symptoms of carpal tunnel that you may already be experiencing are pain. You know, you've got some wrist pain, you've got some pain in the palmar side of your hand, particularly in this area. It can worsen if you wake up in the morning because you were in a flexed position again overnight, or even after spending some time on the computer. You can notice some numbness, some tingling, and it's limited to this area, not on the back of your hand, but just in this area. If you are noticing these symptoms, you're starting to show signs of carpal tunnel. Just want to let you know, carpal tunnel is not simply because of this kind of motion. Other things can cause carpal tunnel, for example, pregnancy, obesity, diabetes, arthritis, various kinds of inflammatory diseases, as you can see in this list. There are other causes of carpal tunnel. So don't think that just because you're feeling these symptoms, it's because of what you're doing, but it could be that what you're doing is just exacerbating some of your other symptoms. So I cannot stress enough, please, if you're experiencing any of these symptoms, go see your doctor, get properly diagnosed before you try anything. Carpal tunnel syndrome is a very common entrapment, which means a trapping of a nerve. It's one of the most common ones we see in the upper extremity. It affects about 6 to 8% of the adult population. Chances are that those numbers are increasing with the amount of time people are spending on, as I mentioned, electronic devices. But interestingly enough, when people think of carpal tunnel, they're only thinking about carpal tunnel, except it actually can affect your entire upper body. So as I was talking about earlier, when you are hunched over, it's affecting your shoulders, it's affecting your muscles, and your forearm is in an internal rotation position, which affects the way your biceps are attached, and a simple change in the way you're using your hands and your wrist can affect your posture and your entire upper body. Because at the end of the day, we are not individual parts. We are a whole body with several parts working together. And that is how osteopathic medicine thinks. We are looking at the whole body and not just at the area of restriction. So what is the treatment for carpal tunnel syndrome? Well, conventional treatment if you went to the doctor, would be rest, modified activities, restricting the activities that's triggering this in the first place, immobilization of your wrist using a splint or a brace. Your doctor may prescribe you anti-inflammatories, whether that's non-steroidal, like your ibuprofen, your Motrin, your Aleve, or steroidal, depending on the severity of your symptoms. Sometimes they may even recommend physical therapy, steroid injections in that area, and worst case scenario, a surgical decompression. So interesting fact, as I was thinking about whether I should be even doing these videos, and I was thinking about carpal tunnel and kind of preparing, there was a moment where I thought, is this even worth it? I mean, who's going to watch it? This is pointless. And the next day I saw 3 patients, all for carpal tunnel, 2 of them who were there for a pre-op because they were getting a surgical decompression. I mean, carpal tunnel is very common and I do see it sporadically, but the fact that I saw 3 on the same day, for me, was divine intervention, that I need to do this because people need to see this, because people don't need to be going through surgery if they can avoid that from happening in the first place or reducing their symptoms. So how do I approach my patients with carpal tunnel syndrome? Well, it always starts with a proper exam. I am moving their hands and their wrists to see how much restriction there is, how much mobility do they have, how much can I move without causing them pain. And depending on the severity of their symptoms, I apply certain types of treatments before I even prescribe the medications. I will present a few of those treatments today, and my next video will talk about the stretches you can do in between those treatments to help prevent your symptoms from worsening. The goal of the treatment, no matter which one I use, is to open up the area of the carpal tunnel, to decrease the restriction and pressure applied on the carpal tunnel and the median nerve, and cause decompression of the median nerve. So to help me with my treatments today is my husband, who has been the greatest benefactor of my osteopathic skills. He is a computer professional who's spending 8+ hours on the computer on a regular basis, and quite often he does have these symptoms of pain and tightness and numbness and tingling in his fingers. But instead of reaching for your Tylenol or your Motrin, he usually has a consultation with Dr. Ansu and feels full relief within a few minutes of the treatment. Imagine allowing your body to heal itself without taking oral medications, that you have to ingest, that has to go through your body and get absorbed, that can potentially irritate your stomach, that can affect your kidney and your liver, that can cause other side effects. I mean, who wouldn't want that, right? And that is where osteopathic manipulation can be helpful. So let's start. So to help me with my treatment today is my husband. This is Roshan. Roshan, say hi.
Hi.
And so for our audience, could you just tell us, what did you experience with the carpal tunnel syndrome? What were your symptoms like?
Sure, yeah. I sit at the desk about 8 to 10 hours a day in front of a computer. I usually don't get up very much, which I know is not good, my wife tells me. But I feel a lot of tightening in my wrists, tingling at my fingertips, and that's really it.
Okay. And usually what do you do to help relieve it?
Yeah, I mean...
Before you got married to me.
Before I got married to my Dr. Wifey, all I usually do is this, and that would give me like, temporary relief. I mean, this is a good stretch, and I would just kind of do that or that. I just kind of crack my knuckles, which is not great.
And can you think back to the first time I did OMT on you? What did you feel, and how have you felt since?
Yeah, it was actually, I believe, our first year of marriage, when you were first taking those courses, I think, the OMT courses, and you were trying out the stretches. I think it was the one where you were actually like moving aside the tendons, and I felt immediate blood flow. Like that time, especially, and ever since then, but really that time, I felt like that tingling down my fingers, like as if like blood was flowing there for the first time.
And that kind of goes with the restriction that I was talking about earlier. When you have pressure built up, it really is compressing your nerve, your tendons, your vessels that are going through. So a little bit of release caused a significant change there. Have you experienced the pain since then, those symptoms since then?
Yeah, to be honest, it comes back every once in a while. I mean, I think mostly because I'm not a very good patient and I don't really do the stretches I'm supposed to be doing, and I don't get away from the computer as much as I should.
Well, at least you admit it. So one of the things that Roshi mentioned earlier was the stretching to the side. There's a term for it. It's called myofascial release. So essentially what we're doing is we're going to take his... Do you have pain in any of your hands right now?
I do actually feel a little tightness here. Yeah.
So, we were talking about the carpal tunnel. So this right here is your carpal tunnel. And what I will be doing is called a myofascial release. So what I do is I extend the hand out completely. So we're extending your fingers backwards, and I'm holding his fingers down with my hand. So does that feel like a good stretch?
Yeah, I think so.
Okay. And the key is never to cause pain. So if your patient ever feels pain, you stop. So I am extending it out. And using my thumbs, I am starting with the center, and I am just putting gentle pressure to the sides. And you do this about a few times, about 5 to 6 times. And this is causing release of the tension that is there. And sometimes doing just something as simple as this can help relieve some of your symptoms. But if you're still feeling symptoms, something else I can do is add what we call muscle energy. Muscle energy is a form of technique where you're using your muscles' natural energy to help heal itself. So what I'm going to do is I'm going to stretch it out the way we did, and I'm applying pressure on the 2 sides of his wrist. And what I want you to do is I want you to flex your hand the way it is when you're on your computer, the way it wants to be.
How do you mean?
You bend it inwards.
Yeah.
You're putting pressure against my hand.
Sure.
And relax. And I am extending it a little further and bend it again. You hold it for about 5 seconds and relax. And one more time. And after every time he relaxes, I'm actually pushing it a little further, going into the barrier and relax. And then I follow that again with the myofascial release, just gentle, pressured stretches. How does that feel?
Oh, it definitely feels more limber. Right?
I did not tell him to say that. So we'll do the other treatment on the other side. So the second treatment we're going to talk about is called the opponens rolls maneuver. It's similar to what we did on the other side, except we are causing a bit more of a stretch. Okay, so I usually start off with the myofascial release. So again, I'm going to extend your hand out, and you're getting that nice stretch in between. Apply that release, moving it to the 2 sides, about 5 times. And this time around, as he's stretching it, I'm going to extend his fingers, but I'm also going to extend his thumb.
Oh, wow. That's a great stretch.
And you do this for about 5 to 6 seconds, and then you come back, and again, do the release, the myofascial release. And again, stretch it out, and you're pulling your thumb out and towards you.
Oh, I feel like immediate stretch, like right there.
Good. And that stretch that he's feeling is his flexor tendon that's going into the fingers. And because I'm extending them, he's feeling extension and stretch of that. Another technique that you can do, to help release some of those tendons is release of the flexor tendon. And you do that by simply applying pressure right here. And you're using my fingers, I'm going in the opposite direction. So I'm just applying pressure here and moving it sideways. And this is helping release some of the tension that's built up from the tendons being tight. Thank you.
Yeah, feels really good.
And how long did that take? That was like what? A couple of minutes on both sides, maybe? Just using this for a few minutes regularly can help relieve a lot of the symptoms. But you have to do something that my husband does not do, which is your regular stretches. Because just like anything, if you don't take care of it, eventually it's going to go back to the state where it wants to be. And I will share those stretches with you in the next video. Another form of the opponent's roll maneuver is instead of extending the palm back, you can push on the two sides of the hands. As you can see here, I am pressing on the two opposite sides of the hand. And as I push on the one side, I am pulling his thumb out and towards him, causing that extension. I personally prefer the one where you are extending the entire hand because you feel a better stretch, but this is also the original way of doing the opponent's roll maneuver. So again, pressing on one side and then extending the thumb out and towards the patient and keeping it there for about 5 seconds. So you may be wondering that how can I use some of these techniques on myself? And that's a valid point if you don't have somebody to do some of these techniques for you. So I do want to share a modified version of the opponent's rolls maneuver, which was the last thing we did with my husband. And for this, all you need is a wall or a hard surface. For our example, I'm just going to use this couch right here. I showed you 2 variations of the opponent's roll maneuver, and I'm going to do both of those. Essentially what you're doing is you are stretching your hand out using that hard surface, and you're pushing down on your fingers against that surface. So you're essentially extending this area. And as you extend it, you're holding your thumb and you're pulling it back and you're pulling it towards you. So essentially it's going this way and that way, okay? And you hold it for about 10 seconds. So 1, 2, 3, 4, I'm feeling that stretch, 7, 8, 9, 10, and you bring it back. I usually recommend patients to just rotate their wrist and do it a couple more times. So again, push down on that hard surface, extend your wrist, and bring your thumb in, out towards you, and pull it up. Again, 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. And again, rotate your wrist. You can also use your inner thigh. If you were to, let's say you're in school or work and you can't really, move around, you can use the side of your hand, press it against the inner thigh, and press towards the thigh. And again, pull your thumb up and out. And again, hold it for about 10 seconds. I hope today's video was helpful to you guys to just learn how to address some of your own carpal tunnel symptoms. In my next video, I will be sharing some of the stretches that my husband mentioned that he forgets to do, that you can do in between these treatments so you can reduce your chances of getting the carpal tunnel symptoms. Please do know that most people may have mild symptoms initially and never do anything about it because it is mild and it does develop over time. As I mentioned about the patient that I had seen, she was suffering for symptoms for over 10 years, eventually resulting in requiring a surgical decompression. So if you were to address your symptoms earlier, less chances of things worsening, less chances of requiring medications or other interventions that may be more permanent. Please remember, before starting any form of therapy to consult your doctor to make sure these exercises are right for you. If you feel pain or worsening of any of your symptoms, please stop immediately. If you like what you saw today, please hit the thumbs up button and like the video, and please don't forget to subscribe to my channel, where I will continue sharing more on what I have learned as an osteopathic physician. And if you have any questions that may have come up as you're watching this video, or any comments, please share, and I will try my best to address them as soon as possible. And until then, please take care, stay safe, and I will see you next week, where you can learn how to do it right with Dr. Ansu. Bye.